Welcome everybody, with you Dr. Magdy Abdel, consultant of infectious diseases, hepatology, and gastroenterology. Our topic today about methods of transmission of HIV. So today we will discuss this subject in detail. HIV is spread by three main routes: sexual contact, significant exposure to infected body fluids or tissues, and from mother to child, and also during pregnancy and delivery or breastfeeding. This is called vertical transmission. There is no risk of acquiring HIV if exposed to feces, nasal secretions, saliva, sputum, sweat, tears, urine, or vomit, unless these are contaminated with blood. It is also possible to be co-infected by more than one strain of HIV, a condition known as HIV superinfection. Sexual route: the most frequent mode of transmission of HIV is through sexual contact with an infected person. However, an HIV positive person who has an undetectable viral load as a result of long-term treatment has effectively no risk of transmitting HIV sexually. The existence of functionally non-contagious HIV positive people on antiretroviral therapy was controversially publicized in the 2008 and has since become accepted as medically sound. Globally, the most common mode of HIV transmission is via sexual contacts between people of the opposite sex. However, the pattern of transmission varies among countries. So, in the United States, occurred among men who had sex with men. About 82% of new HIV diagnoses among males aged from 13 and older, and 70% of total new diagnoses. So, in the United States, gay and bisexual men aged 13 to 24 years accounted for an estimated 92% of new HIV diagnoses among all men in their age group, and 27% of new diagnoses among all gay and bisexual men. With regard to unprotected heterosexual contacts, estimates of the risk of HIV transmission per sexually act appear to be 4 to 10 times higher in low-income countries than in high-income countries. In low-income countries, the risk of female-to-male transmission is estimated about less than 1% per act, and of male-to-male transmission is also less than 1%. So, in the first equation is about 0.38%, and in the next equation it's about 0.3% per act. The equivalent estimates for high-income countries are about 0.04% per act for female-to-male transmission. So, the risk of transmission from anal intercourse is especially high. Estimate about 1.4 to 1.7% per act in both heterosexual and homosexual. contacts, while the risk of transmission from oral sex is relatively very low. It is still present, but very low transmission. The risk from receiving oral sex has been described as nearly nil. However, a few cases have been reported. The per act risk is estimated at from 0 to 0.04% for receptive oral intercourse. In setting involving prostitution, in low-income countries, the risk of female-to-male transmission has been estimated as 2.4% per act of male-to-female transmission, as 0.05% per act. Risk of transmission increases in the presence of many sexual transmitted infections and genital ulcers. Genital ulcers appear to increase the risk approximately fivefold. Other sexual transmitted infections such as gonorrhea, chlamydia, and trichomoniasis and bacterial vaginosis are associated with somewhat smaller increases in the risk of transmission. The viral load of an infected person is an important risk factor in both sexually and mother-to-child transmission. During the first 2.5 months of HIV infection, a person's infectiousness is 12 times higher due to the high viral load associated with acute HIV infection. If the person is in the late stages of infection, rates of transmission are approximately eightfold greater. So, commercial sex workers, including those in the pornography, have an increased likelihood of contracting HIV. Rough sex can be a factor associated with increased risk of transmission. Sexual assault is also believed to carry an increased risk of HIV transmission. As condoms are rarely worn, physical trauma to the vaginal or rectum is likely, and there may be a greater risk of concurrent sexual transmitted infections. Thank you very much.